By classifying a nerve injury, it can be classified as Sodon, Sunderland, or Birch and Boney. Sodon classification classified into three types: nervaprexia, exontemesis, and neurotemesis. This classification categorizes in three categories because of number one, demyelination; number two, extent of damage to axons; number three, damage to the connective tissue around the nerve. Nervaprexia, the nerve and axon is in continuity. There is no damage to the axons and there is segmental demyelination is possible. This is non-degenerative, it's physiological block, no vulnar degeneration, full recovery in 3 to 6 months. Exontemesis, axon damage. Focal demyelination, there is vulnar degeneration. Neurotemesis, it's a connective tissue and axons are fully transected, disruption of epineurium and degenerative type, and no recovery unless surgical intervention is done. Sunderland classification, type 1 is a physiological block, and type 1 is a physiological block as Sodon's nervaprexia. Type 5 is a Sodon neurotemesis, and type 2 is exontemesis, axon damage. Type 3 is damage to endoneurium, and type 4 is damage to the perineurium. In another way, type 1 is when there is myelin loss. Type 2 is when axon is damaged. Type 3 is when endoneurium is damaged. Type 4 is when perineurium is damaged, and type 5 corresponds to complete transection. There is type 6 as well, which shows a mixture of all the nerve injuries at different positions. Then is a Birch and Boney classification, classified into two: degenerative or conduction. In degenerative, there is a direct cut to the nerve, and conduction is the conduction block, but this can progress further if not treated.